So this model shows us a whole thickness section of the skin. We have the epidermis with the basement membrane zone, then the dermis, and then this yellow bit is adipose hypodermis on this model. So let's start off by looking at the top here. Here we see the dermal papillae, which, as you remember, project up into the epidermis. So here we see a dermal papillae here, and these represent dermal papillae projecting up into the epidermis, which is on top. When we look at the top of the epidermis, we see that there's pores here for the sweat to come out of, the sweat gland ducts. And we can also see here the hairs penetrating through the epidermis. And we can notice the layers of the epidermis, the basal layer of the epidermis, the stratum basale, the germinative layer, just here. Then above that, the spiky or the thorny layer, the stratum spinosum. Above that, the stratum granulosum with the little grains. Then this yellow bit here would be the stratum lucidium, the lucid or the translucent layer, and then the stratum corneum, the horny layer above here. And finally the cells will be sloughed off the surface, the layers of the epidermis. Going down into the dermis, here we see Meissner corpuscles, the mechanoreceptors detecting light touch, with their sensory neurons going off down towards the central nervous system. And here we see the Pacinian receptors with their specialised Schwann cells that detect pressure, again with sensory nerve fibres going off towards the central nervous system. And we don't see it on this model, but we know that there are free nerve fibres penetrating through the dermis, giving rise to sensations such as pain, heat, cold, itch and tickle. And we notice that there is a superficial blood plexus, superficial vascular plexus, near the surface of the dermis. So here we see small arterial vessels, small venous vessels and large capillary networks. And we also notice that there's a deeper plexus of larger blood vessels in the hypodermis. And we know that these penetrate up from below through the muscle fascia from deeper muscles beneath. Also on this model we see the cross section of the eccrine sweat gland, the glandular portion and the duct. The sweat rises up the duct to the surface of the body, where it evaporates, extracting the latent heat of vaporization from the body. And here we see the same thing in a more three-dimensional type of structure. The glandular portion and the ductile portion. And here we see the larger apocrine sweat gland, producing sweat which is on the surface of the body is acted on by bacteria, giving rise to characteristic smells. And actually, in proper anatomy, most of these ducts don't open directly onto the surface. The vast majority of them actually open into hair follicles, and the apocrine sweat comes out via the hair follicle in the majority of cases. Here we see the adipocytes of the hypodermis, the fatty layer. And here we see the hair follicles, the hair shaft growing out of the hair follicle. And we notice that there is epidermal tissue going all the way down into the hair follicle. We notice that there's a papillae, a hair papillae, growing underneath the hair there, so the hair can grow, supplying the hair with oxygen and nutrients for the active mitosis, which is going on in the germinative layer. And we also notice that there's an arterial and a venous blood supply to the dermal papillae, in this case the hair papillae. We notice the sebaceous gland producing sebum, which is passing directly from the sebaceous gland into the hair follicle to arise up and moisten the surface of the epidermis. And we also see the hair erector muscles, the erector pillae here, the hair erector muscles that will contract, moving the hair in that direction, making the hair shaft more erect. So when that muscle contracts, the hair is moved into a more erect position. So this just gives us some of the structures that we've talked about in a cross-section of the skin in this quite useful enlarged model.